Okay, yeah, that's fine. So I'm gonna go over what we're gonna do for your upper jaw surgery. Okay. So like I said, I like where your midlines are. Okay, even though your nose is off to the one side, but for the upper jaw surgery, all the incisions are made inside the mouth. Okay, they're done
Right.
kind of tucked up under the gum line. You'll have an incision basically from molar to molar. All
Okay.
around here, okay?
Okay.
And the incisions, what we do is, and then we reflect the tissue away, get to the lateral edges of your nose, okay?
Okay.
There's two holes that are here, which is a nerve, a sensory nerve
Yeah.
that gives you sensation to your midface, okay?
Okay.
We don't disrupt that nerve, but we identify it, and because we're doing the surgery and retracting it, you're gonna have numbness, guaranteed.
Oh, okay.
Okay. Numbness is a good thing because if you can't feel, that means you don't have as much pain.
That means I don't have as much pain, right?
Exactly. So it's a benefit for us, okay?
Yeah,
So we
definitely.
reflect everything, and what we end up doing is we end up making a bony cut from the back of the upper jaw to the lateral wall of the nose, and then from this side to the back side, okay? And then we have to split the septum. Okay, that we do, and then there's some bones in the back here that we need to split as well. Okay,
Lovely.
eventually when we do that, what we end up getting is we end up separating the upper jaw from your cranial base. Okay, and we
Okay.
separate it. We never take it out of your mouth. In the back, it's always attached to the soft tissue and the blood supply that's there. Okay, and then we're able to move it, side to side or forward or down or back, whatever we need to do. Okay,
Okay.
and then all those movements of how we need to do it are based on what we're doing today. Okay, and for you, just looking at what things are, you're gonna definitely be coming forward. Okay. We
Right.
may not need to go up and down because when you smile, you show your full tooth and a little bit of the gum, which is exactly what we'd want for a female. Okay.
Yeah.
I may need to go if we're going up, if we're going forward a little bit more. We may need to impact you, but your smile will change. You may show a little bit more, gum. For a female, about 2 millimeters of gum show is what we call acceptable. Okay. But we may need to impact you a little bit on the front. Okay.
Okay.
And then go forward. And then we take plates and screws similar to this, but different shapes, and then we kind of fixate you where we want you. The way we know where the mandible needs to go is because we measure you from wires that we put in, and also we move the upper jaw first, and then wherever your lower jaw is, when we do our surgery, like our what we call model surgery in the lab, we relate where your old jaw is and where we want your new jaw, and then we make a splint. So we wire you shut, so we know where the upper jaw needs to be, and then we fixate it back to the upper jaw or to your cranial base. Okay, and then and then we take you out of fixation, and then your upper jaw is at a new position.
Okay.
And then we also have a splint that shows us where your new upper jaw is supposed to be with your new lower jaw. Wire you shut and do it that way, okay? So obviously if you look here, these are the sinuses, and that's why you need to be on those sinus precautions because you go right into them.
Right.
Okay?
Yeah.
So that is the upper jaw. Sometimes when you make the cut, sometimes you can get a little kind of bruising. You'll bruise, you'll swell, kind of on the palate, kind of like a big pizza burn. If that happens, it just kind of heals, but it's really annoying.
Yeah.
And that's about it. Now, when we do a multi-piece Lefort, which is potentially what you have, it's I can't split it up, but basically, we make a cut through where you have those gaps, okay, usually in front or behind that canine tooth, okay,
Right.
and then we're able to split it up into multi-pieces, so then we can move things however we need. If we need to put this segment down or up, we can do it. If we need the front down and the back up, we can do that in multi-pieces. The only bigger risk is when we do multi-piece upper jaws, there's a higher risk of lack of blood supply, okay? And it's very, very, very rare that we ever have a necrosis, meaning something that doesn't survive, because we only reflect the tissue that we need to, okay? But when we do multi-piece Leforts, we have to make some more incisions, and so you run that risk, okay? The benefit outweighs the risks for it, okay? It's very rare, but I just need to make you aware of that because it has happened many, many, many years ago. So that's the upper jaw, okay? Now the lower jaw is basically this. I'm gonna not use this because it doesn't show us anything. It's just a fall probably. So the lower jaw surgery is, this is the one I want you to pay attention to, is what you're gonna get, okay?
Yep.
So the lower jaw surgery, most of the incisions, for this one, are inside the mouth. The big incisions are inside the mouth, all the way in the back, kind of where you had your wisdom teeth. That's where the incisions are. That's why we need you to have your wisdom teeth out, because that's where the bony cuts are made, which you've had. So what we do is inside, we make an incision kind of all the way in the back, and we end up making, what we do is on your tongue side of things, there's a little hole here too, just like that upper jaw. And in there's a nerve that runs and supplies your chin, your lower teeth, your lower lip. And what we do is we find that nerve, identify it, and the cuts we make, we go above it. So we don't harm it, okay? And then we make cuts kind of going forward and then off to the side, okay? And then what ends up happening is basically you end up getting a cut like this. Okay. Where we're able to slide you how we need to go.
Yep.
All right. The way I kind of described it is, in terms of the nerve, it's like two pieces of bread with a spaghetti in between. Okay.
Okay.
So the stretching of that nerve, especially because of the amount that we're going to need to go, you're definitely going to have numbness. Upper and lower, you're guaranteed to have numbness. It's not a complication; it's an expectation. Okay. You will have that. All right. And then based on how much forward you need to go, for you, one side's going to move more than the other just because your midline is off. And so what we do is we fix, once we make the cuts on both sides, we wire your jaw shut to its final position, and then this will slide, and then we screw it into its new position. Okay. Now the way that we need to put the screws in for this side is, because the cheek is there, we can't go 90 degrees to it. So what we do is we need to make a 3 millimeter nick incision on your cheek and go in this way to be able to place the screws. Okay. So you'll have 2 small nick incisions on your cheek on both sides that are closed by like 1 or 2 stitches. That's it.
Great.
No real issues for scars or anything. You're fairer, so you may have some redness around that area, but nobody really complains about that. Okay. So that's the lower jaw surgery. Okay. Now, if you need a chin that we need to do, that surgery is done kind of similar to these cuts. This one's done all inside the mouth. We expose the area. There's also 2 holes here, and those holes are different nerves. Okay, and this one is the same nerve that goes here, but it exits here and then gives a sensation to the lower lip and chin. So we find those nerves, make our cuts underneath it, and then I can't move it forward here, but we can move forward as we need to. Okay. And the reason for sleep apnea, patients who get sleep apnea, the reason this works is these little bumps that are here in the back, that's attached to the tongue. Okay. So if we move that part forward, the tongue comes forward, hence the airway in the back opens up. Okay, and that's why if you have people with sleep apnea, if they want surgical correction, that's part of the surgery that we do for them. Okay. But you, because your mandible is going to be coming forward a little bit, I think after all the numbers work out, it'll probably come forward a little bit. It will help a little bit with. You don't have sleep apnea, but it will help open your airway.
Snoring
and
great.
It may or may not help with the snoring, because I think your snoring may be more nasally driven than orally driven. So it may or may not. All right.
Cool, yeah.
So that is the actual surgery. Questions about the upper or lower jaw or the chin?